24/7. Welcome to Dr. NDTV, the health show in which experts in our studio will answer all your health problems. 10 years ago, most fat people were comfortable and happy. Now, doctors, the media, and various slimming centers all over the country are drilling into us that to be overweight is to be unhealthy and unattractive. Is this all true, or is it all media hype? To discuss obesity, we have today Ms. Vandana Luthra, Chairman, VLCC, and Dr. Pradeep Chowbey, Chairman, who is the Department of Laparoscopic Surgery at Sir Gangaram Hospital, and also surgeon to the President of India. So if you want to ask any questions about obesity, call us at 011-516-33300, log on to our website, drndtv.com, or SMS us your questions at 6388. Dr. Chowbey, what's wrong with being fat?
Well, obesity has got its own medical problems. Apart from a cosmetically bad appearance and social problems, medical problems like severe diabetes, hypertension, cardiac problems, sleep apneas, joint problems, back problems, all these problems become much more pronounced in obese patients.
So you get more blood pressure if you're fat, and if you become thin, your blood pressure becomes low.
And also it is more difficult to handle those situations. You need more medications, you need more therapies to control that within the normal limits.
Mr. Luthra, isn't it a matter of sort of personal taste, whether Dr. Chowbey was saying an obese patient is unattractive? But I mean, when I was young, say 30 years ago, Bollywood stars were all overweight. Now, everyone seems to be striving to be slim. Isn't it, aren't we being sort of harassed by media hype?
Well, I don't think so. I think Dr. Chowbey has shown his concern, and I think he's very right, because it's very unhealthy to be obese. Like earlier it was considered as a superficial cosmetic problem, but today it's become an epidemic in society. And even doctors are finding it very difficult to treat obesity. And we as professionals over a period have been really struggling hard to fight against obesity. And considering the concern we have for people, like we're very concerned about public health, and we are very concerned that people don't go obese. But putting people on the right track and telling them
about attraction, that it was thought to be sexy, say 20 years ago. In Bollywood, if the woman is overweight, now they're all very slim. Isn't there something wrong with the whole system?
There's nothing wrong with the whole system, doctor, but as I told you, it's very unhealthy to be obese, and there have been a lot of medical problems because of obesity. Early deaths, you must have heard of it, and being a doctor yourself, and there's been a lot of research, a lot of studies that show that obesity is like a disease in society, and we have to treat it in a very, very professional, scientific manner, and we have to handle it properly, and it's not attractive to be obese at all. I think it's very unhealthy.
Tell me, a person who is overweight comes to your center, one of your centers, and says, Mr. Luthra, I'm overweight, what can I do about it? Where do you start?
Well, first of all, the concept of weight loss, what exactly weight loss is all about, and concern for health, it has to be actually conveyed to a person. Now, when a person comes to us, he's totally unaware, doesn't know what to eat, doesn't know where to go, probably suffering from a medical problem because of obesity. So first of all, they have to be put on the right direction, and a focus has to be given to them that this is your right track and this is what you have to do. Secondly, then a little bit of...
What do you tell them exactly?
Well, a little bit of diet modification, behavior modification.
Modification means you eat less.
Eat less, eat the right kind of food. We are emphasizing more on the quality of food.
What kind of food?
Well, a balanced food, a balanced meal, which has, which is high in fiber, low in fat, which has carbohydrates, proteins, minerals, vitamins, everything. Yes. That's a balanced meal, and we want people to eat everything, and we don't want to put them with any appetite suppressants or any drugs. A very natural weight loss where we just give them a focus in life, a direction in life, and we tell them exactly what is the scientific way to lose weight, which we try and handle.
Chowbey, what kind of exercise would you advise a person who is overweight?
Generally, see, as a surgeon, we come into picture only for the morbidly obese patients.
What's a morbidly obese?
Generally, is the calculation of BMI, the body mass index, where the weight in kilogram is divided by the height.
That's a formula.
Yeah, it's a
complicated formula.
Yeah, but generally speaking, one would say that about 40 or 50 kg above the normal desired weight.
And how do you know what's your normal desired weight?
By calculating the height and
there are tables.
Various tables, and everybody can know. It's a very simple table. Can know what should be the ideal weight.
Are these available for Indians, these tables?
Yes, they are prepared by the Life Insurance Corporation for the Indian population, and they're very easily available, and it can be found out. And if, generally speaking, if there's about 40 to 50 kg above the normal
50 kg
after above, they are classified as morbidly obese patients. We don't call them persons because they are no more persons, they become patients. Because morbid obesity is classified into medical science as the disease. It is not a cosmetic thing. So those are the patients which are difficult on a long-term basis to handle by only diet modifications and exercises. They need a little further to it because of the metabolic problems which the body faces.
What sort of diseases that they have? You know, people say that, you know, if your thyroid is underactive or some glands are overactive, then you become overweight. Do you find that?
That's right, but those are the medical causes like hypothyroidism and other things. But those are the curable causes where you can cure those problems. And
these are very few.
Very few. Majority of them, they have a genetic problem with metabolism. So the same amount of food may produce much more weight in those patients, and they become so-called disease, so morbid obese patients. And those are the patients who are most benefited by the permanent cures of surgery.
Surgery.
Yeah.
Before we get to surgery, Ms. Luthra, what kinds of people come to you to lose weight? Because it seems that in Western countries, the poor generally are overweight and the rich are slim. Is that true in India as well?
Well, that's a wrong notion. I think obesity is something which is a common thing between, amongst people, and we get people from all income groups, and we feel that, they really want to lose weight, and we sort of, with the diet modification, a little more than what Dr. Chowbey said, that we put them on the body composition analyzers, equipment.
So you have all sorts of people coming to you.
So there are all kinds of people coming to us, and we basically sort of assess their BMI, the basal metabolic rate, and tell them how much of activity is required, how many calories a person requires.
We have a caller, Manju Malik from Ludhiana. Please ask your question, Manju.
Good afternoon, everybody.
Good afternoon.
My question is from Madam Vanna Luthra. Good afternoon, ma'am.
Good afternoon.
Yeah, I am 5 feet 3 inches and I weigh 61 kg. My problem is that I'm trying to lose weight, but I'm not helping myself by losing weight from the lower portion. So I'm losing my weight from the waistline, but not from the lower portion. How should I help myself?
Well, first of all, I think you're overweight by 5 or 6 kilos. Nothing to worry about. What you require is, I can't really tell you exactly here, but definitely I can give you a few guidelines. Is that first of all, a diet which is low in fat and which is high in fiber, you must go in for it, and how much you require a little bit of activity, and I recommend strongly of at least 45 minutes to 1 hour of walk every day. And if you could come and go to any professional slimming setup and go through a BCA test, which actually tells you what your BMR rate is and how much of activity.
What's a BMR?
It's your basal metabolic rate, and normally for people when it's very slow, it's a problem. So then with a little bit of activity and with a little bit of diet modification, and if you're required to go on certain appliances, like you said, that on the lower part of your body the weight is low, so I think you need professional help and you need to visit us and lose weight in a more professional way. But and you can check on your diet and a little bit of activity. I'm sure you'll be able to help yourself, but you definitely need professional help at this stage.
We have another caller, Bhavik Shah from Delhi. Please ask your question.
Yeah, good afternoon to all of you.
Good afternoon.
Yeah, ma'am, I would like to ask a question that if a person has lost weight in your center or any other center, how do you keep it up after that? After doing that, all the workouts of 3 months or 4 months, how can you do that? How can you maintain that?
That's a very important question.
Very important question, yes, and that's a very good question. And weight maintenance is a very, very important part of our weight loss program. What we are doing is actually we're just modifying your diet. So once you're modifying your diet, we're not giving you any appetite suppressants, or we're not giving you any artificial food packets or any drugs. We're losing weight the natural way. So for everybody, it's very difficult to maintain the weight. You become nutritionist in yourself after some time, and your counselors in yourself. You would probably be able to tell anybody how to teach anybody to lose weight on your own. And it's because you're eating your normal food, and there's activity that there's some reasonable activity that you are doing every day. So it's very easy to sort of help yourself after you lose weight at VLCC.
Dr. Chowbey, a lot of people who try diets and exercise, they lose weight, and as the caller said, Mr. Shah, regain the weight. What would you advise them? Would you tell them to take some pills to lose weight?
No, not really. I mean, the pills, etc., they again are for a very short period. It cannot go on.
Are they dangerous?
They have their side effects and the problems. And one has to very closely monitor those persons who are on these medications. So generally, as I said, probably it is better that they are under the medical supervision or supervision of the experts or the centers, where they can continue the weight which they have lost.
So regular
supervision.
So it's now time for a quick break, but if you have any questions about obesity, please call us at 011-516-33300. Log on to our website, drndtv.com, where there's a lot about obesity, or SMS us at 6388. Welcome back. You're watching Dr. NDTV, and we're discussing obesity with Dr. Pradeep Chowbey and Ms. Vandana Luthra. Dr. Chowbey, you're discussing drugs, treatment with pills. Are these effective in people who are overweight?
Well, I think I wouldn't really encourage this, because these are the drugs which are dangerous. They have got a lot of side effects.
What kind of side effects?
Oh, I mean, it can range from gastritis to any extent of
inflammation.
And to the blood discourages, where the blood formation stops. So these are the life-threatening situations. So drug is always to be discouraged. They are dangerous.
So you never advise drugs?
I never advise drugs.
Ms. Luthra, do you agree with that?
I absolutely agree with Dr. Chowbey. I think it's very wrong to take drugs, and why should want to take drugs as a very natural way to lose weight, then why should one get into these kind of things?
But there are people who fail to lose weight or by natural ways. What would you do then?
I think they generally fail because they want to take a shortcut, because they don't want to work for losing weight. You have to work for losing weight in terms of diet, modeling.
You've gone to the wrong training center, and not to VLCC.
Yeah, that's a shortcut, isn't it? That's a shortcut. It's not safe for them to do that.
It's not a plug.
It's not something which you pop in and the weight comes out. It's not like that. It should be taken seriously.
Seriously for how long?
You should go to the right professionals, like you have to go to the right centers, the right professionals, the right doctors.
Okay, here am I, overweight by 40 kilograms. I've been to various slimming centers, including VLCC. haven't lost weight. I come to you, Dr. Chowbey, please help me. You say, I can't take drugs. What can I do? My blood pressure is going up. I have diabetes. I have arthritis. How will you help me?
That is where this role of laparoscopic surgery comes in. Though the conventional and open surgeries were available for obesity.
Surgery for obesity.
But they have now been modified into the laparoscopic surgery.
I think we'll come back to this, Dr. Chowbey, because we've got a caller, Roshan Kola in Karnataka. Please ask your question.
Hello.
Hello, yes, ask your question.
Yes. I'm 24 years old. I'm 85 kgs of weight. Hello?
Yes, carry on.
I weigh 85 kgs. I wanted to lose around 10 kgs, sir. And I wanted to know whether it is good to go to like Vandana Lutra's any other clinic or any Vandana Lutra clinic, and it is advisable to go there actually.
Is it advisable to go there? We can't ask Vandana Lutra, but we'll ask Dr. Chowbey.
Because this
Sorry, yes? Yeah, sorry.
It definitely requires reduction of weight to 10 kilograms, and surely they should go to UNCC and
Or some other
slimming center, whatever is convenient to them. But certainly they should take care of that overweight.
Smita, do you sort of customize your advice to the individual? Say that, you know, a 60-year-old man wants to lose weight or a 20-year-old girl wants to lose weight. Do you give them different diets and different exercises and all that? Let's start with a 20-year-old girl.
See, every weight loss program is very, very personalized. You cannot do it for everybody. It's very personalized. And
what do you ask the people?
Well, first of all, before asking, we sort of motivate them, counsel them, and then get to know exactly what their requirements are. We don't really ask them, we find out ourselves.
By counseling, you say that you'd be a very attractive person if you were slim. And if you continue to be overweight, you'd be unhealthy. Isn't that right?
Well, not only that, our counseling involves a lot of motivation, encouragement, because people who are very obese are, very demotivated, and they're very, very complex. And
are they depressed?
They're very depressed, and that's where our counselors play a very, very important role with our psychologists, which we have in our panel. And we have to motivate and counsel these people constantly, and then tell them exactly what is the right kind of program for them, put them on the BCAs, get their programs medically monitored, our nutritionists are there, our cosmetologists are there, our physiotherapists are there, our nurses are there. So it's a whole lot of people working on one person. Not only one person working on it.
It's okay to say that people who are fat are happy.
Yeah, they're not happy, definitely.
And they're depressed.
They're very, very depressed, very low.
Sorry, Dr. Chowbey, we are going on to surgery for morbid obesity, a certain group of people. What percentage of the total numbers would you say of people who are obese need surgery?
Well, I think looking at the macros, the figures which have come, is almost about 2% of the macro population, affluent population, has got the problem of morbid obesity. Who are about 40 kg more. They look huge.
And who have failed.
And who have failed in all the way. And those are the patients, instead of, because like premature death.
So that's a huge number in a big country.
Yes.
Okay,
and that is the point which is very important from Indian perspective.
So it's now time for another break, but if you have any questions on obesity, call us at 011-516-33300, log on to our website drndtv.com, or SMS us at 6388. Welcome back. You're watching Dr. NDTV, and we're discussing obesity with Ms. Vandana Luthra and Dr. Pradeep Chowbey. We have a caller, Rashmi from Delhi. Rashmi, please ask your question.
Rashmi from Delhi.
Very good afternoon, sir.
Good afternoon.
Very good afternoon, sir. I'm Rashmi from Delhi. I'm 28. I'm 28 years old, and I'm suffering from thyroid. Actually, I'm taking so many medicines for this, but intake of calories. But still I'm not getting the complete advantage of it. Can you suggest me something?
Are you overweight, Rashmi?
I am 5'3", and my weight is 80 kg.
80?
Yeah.
So I think Dr. Chowbey will answer that question.
I think basically what she needs is the management of a thyroid problem. I think probably it must be a hypothyroid state where the thyroid
it's too little thyroid hormone.
Yeah, less thyroid hormones are produced. So which are to be supplemented from outside, and also to be monitored by regular blood examinations and medical examinations.
Together with Luthra's treatment.
Here these body therapies play a very, very important role. The thyroid patients, the weight loss is very, very slow. But a lot of counseling, and again body therapies really help with the appliances, where the fat is mobilized and skin is also tight. And they feel very good and positive about a program, and they get
body therapy?
Body massages, different kind of massages where we mobilize the fat, and a lot of skin toning is done, and muscle toning. So what happens is, with counseling and when the program is medically monitored by the doctor, all these things put together lead to weight loss, but the weight loss is definitely very slow. It's nothing beyond 2 to 3 kilos in a month, and which we already told them that this is what is going to
Dr. Chowbey, you're talking about surgery, and what kinds of operations would you do for obesity?
Well, I think the
everything else having failed,
yes,
then you do surgery.
That's the last resort. And surgery is, I always maintain that it's a life-saving surgery from that patient. It's not a cosmetic surgery. It's a life-saving surgery. And when it is a life-saving surgery, one has to wait like that. The commonest and the simplest operation which we do is putting in a silicone band into the stomach. And by putting a silicone band, it's a daycare procedure. Patients are admitted just for a night or so, and they go back. Now this band constricts the stomach and makes a small cavity. A big stomach, the volume is reduced. This is known as a volume reduction surgery. And hence, the patient, when he takes a small amount of quantity of food, he feels full and his appetite is over. He doesn't feel hungry.
What do you say, he?
It could be she as well, the patient. Either it can be he or she, and they feel full. So a small amount of food satisfies what we call, they get satiety. And they feel...
What are the dangers of this operation?
Well, I think it's a fairly safe operation. So millions and millions of these operations have been done all over the world. It's a fairly safe operation.
And can you maintain your weight?
Yes. This is the band which is there inside the abdomen throughout.
Is this the band?
This is the band which goes, and the stomach gets is put on the stomach like the wristband here, and then it has got a port from where we can inflate this band. Now, once this band is placed in the stomach, the capacity of the stomach reduces to about 30.
But the number of people who need operation is very small.
Very small.
But there are certain numbers.
The number is growing.
To save life.
The number is growing. And this particular small operation like this can prevent the early death of these patients.
Okay. Ms. Luthra, give us a message for obese patients, final message.
Well, I think health is your ultimate wealth, and please take care of it. And with that, I wish you all the very best.
Dr. Chowbey?
I would say that if some persons are morbidly obese, they should just not give up hope.
Yeah.
Because there is a surgical hope.
Yeah. That's all we have time for today. The message is that obesity is a bad thing, but there are a lot of people to help you, from the Vandana Luthras of the world to the Pradeep Chowbeys. So if you want to know more about health, log on to our website, drndtv.com. And for now, it's news on NDTV 24/7.